Private 24-hour care facilities house hundreds of people in Utah who are disabled. And after legislative failures, they are struggling to stay alive. ABC4's Sarah Martin takes a deep dive into the needs of the intellectually disabled and a lawsuit threatening their homes.
Medically fragile individuals and their families have a few choices for care here in Utah. A lawsuit against the Department of Health this spring worked to expand those options, but caregivers say it may have had unintended consequences. Topham's Tiny Tots is a private 24-hour care facility for the intellectually disabled, or an ICF, paid for by Medicaid.
They saved my life is how I feel, really, in a lot of respects. And I view them as a partner.
Alice Sutton chose Topham's when her son Stephen was just 4 years old, already too fragile to be taken care of at home. He's now 32 years old.
I trust them. We've built that trust back and forth over 28 years. And they are his second family.
Stephen is one of 42 people currently being cared for at Topham's, where individuals receive medical care, skills training, individualized treatments, and all other necessities.
All ICFs have come a long way, and I know that any current owner of the 16 ICFs in the state of Utah truly love the individuals and love what they do.
Christine Mason is a third-generation caregiver here at Topham's. She says in the 43 years they've been open, they've helped people from every walk of life and with every ability level. But now a settlement in the legislature may threaten their future.
I feel like their lawsuit is somewhat ridiculous. It negatively affects us because eventually our census will be brought down to a point where we're not able to keep our doors open and offer the services that we have for 43 years.
The class action lawsuit against the Department of Health argued that the state of Utah wasn't in compliance with a Supreme Court decision stating a person should be given access to community-based resources instead of treatment in private ICFs whenever possible.
As we looked into it, the way that the system was set up, it actually was really difficult to move out of an ICF ID if you wanted to take your services with you.
The Department of Health calculates that a person in an ICF costs the state about $70,000 per year. But when that person transitions to community-based services, the price tag goes up to $100,000 per year. The lawsuit named two individuals who had unsuccessfully tried to relocate, calling ICFs institutions and claiming that in some cases they were segregated, isolated, overcrowded, and understaffed.
To talk about how they're segregated away from family and friends is absolutely not true. How they're left laying in dirty diapers and sitting in front of windows just staring all day is absolutely not true. My experience here has been the complete opposite of that.
It's really critical to convey that nothing in this settlement requires anybody to move who doesn't want to move.
The class action was settled this spring during the legislative session with the decision that over the next 4 years, the number of people offered the opportunity to transition out of an ICF and into a community care option would increase from about 16 per year to 50 people per year. The goal being that the total number of ICF beds in Utah will drop from about 600 to about 400. But the legislature also cut the funding intended to help ICFs survive that transition.
They did not fund one of the requests that we contemplated as part of our full package, and that was a $2.4 million request in general fund to be able to provide quality incentives for the ICF facilities.
So I'd like to say, what exactly is the plan here? You're going to hobble these facilities and paint them as a place that segregates people. I don't know where I'm going to go. I don't know what will happen to Stephen.
The Department of Health has a final hearing on this case in October, and both the Department of Health and the Disability Law Center told me they are planning on communicating more fully with parents in the near future. Back to you guys.